In this video, I'm going to take you through a 20-minute workout for your knee or hip osteoarthritis with dumbbells. So it is going to be a toughie, and you are going to need a couple of dumbbells or maybe one larger dumbbell to hand for the rest of the video. I promise you, I've picked every single one of these exercises, if you practice them, to try and make your day a little bit easier if you have joint pain. So we're going for 30 seconds of work, 30 seconds of rest. I've got a timer here in front of me that I'm going to start now. And the first exercise is going to be a sit to stand with weight. So you're just going to try and stand up and sit down. Off you go. So push through the feet, push through those knees and hips, and you can choose whatever weight you feel comfortable with. It could be a couple of cans of beans if you want to start off nice and light, and then you can build up as you feel more comfortable. Now, how much is the right amount? That's going to be very much dependent on each exercise. You might find them, stop there, different in difficulty. But what you're looking for is to feel challenged by the time you get to the end of the exercise. So this time we're going to do a deadlift. So that's this movement here, straight back, leaning forwards, and we're just going to the chair. So we're going halfway. We're going to lift up the weight and straighten up. Touch the weight down to the chair, nice straight back, and then stand up. Good. So you should feel this one is more for the hamstrings. You feel in the back of the legs, maybe your bum cheeks, and your lower back as well. This is an exercise I give to all of my patients, particularly those with back pain and those that are worried about bending and lifting, because this is a nice way to gradually build that up over time. So I think I'm probably going to grab slightly lighter weight for the next exercise. Get that out of the way. And we're going for a single leg squat. So you might want to keep your chair to hold on. I'm going to hold on to the wall, and you're just going to try and do a little single leg squat on one side and then come back up. So I'm going to go right leg first. We're going to hold on. You're going to come down, back up. Now obviously you can progress this with working through more range of movement. So if you feel like you want to go a little bit lower, then feel free. I'm just going to work to there. Planning on filming a few workout videos today, so this is number 2. I've only got another 4 to go, so I'm going to try and start off nice and easy. Okay, 5 seconds left. Well done. Last one. Perfect. Really simple. Next one, other leg. So change your weight. If you haven't got dumbbells at home, you could use a rucksack, chuck a few heavy books in, a few cans of food, bags of rice, whatever you can find. But this time we're going to do opposite leg. So hold on with one hand. This hand is going to be holding on to the weight. Just going to do a little squat down and back up. Little squat down and back up. A few more seconds of rest, much needed rest, and then off we go. Now, these exercises are strength exercises. They are not balance exercises. So do not feel like holding on is cheating. I'd much rather you hold on and you feel stable and you can work through more range than not holding on, feeling like you can only do a small one because you're off balance. You cannot load yourself sufficiently if you're off balance. So make sure you're stable. We can save the balance exercise for another day. Okay, right. This time, heel raises. So I'm going to hold on with one hand. I'm going to hold on to the weight with the other hand. I'm going to try and come up and then down, up and then down. From the side, you're rolling right up onto your toes, and you are trying to work through as much range as you can. So you're trying to get right up onto your first and second toe if possible. All the way up, slowly down. So this is an exercise for your calf muscles. Hopefully you can feel it in your calves. And then slowly down. I certainly can. Why do we need good calf strength? Well, our calves are really important for walking, stairs, any movement that involves you pushing off through your toes. Okay, brilliant work. Next exercise, squats. So similar to the sit to stand, but we're going to imagine, well, we're not going to imagine, the chair is not going to be there. So hold on to your weight, bottom out. Now, this is why sometimes it's nice to use the chair, because it's a good cue for where your bottom needs to go, but you don't want your knees coming over your toes if you can help it. You want bottom back, hips back when you're doing a squat. So bottom out. If you look down, you should be able to see your toes. So that's a good sign that your knees are not coming too far forward. So bottom out, knees behind your toes. Keep a nice straight back. Keep looking forwards and work through whatever feels comfortable. So if you've got knee pain, you want to go 20%, 25% of the movement, that's absolutely fine. What we don't want to do is do too much too soon, make it sore, and then you don't want to do it again. So we need to make sure that we're working at a level that we're happy with. Next exercise is going to be a lateral step. So if we go right leg first, so this is the one that's going to be doing the work, and we're just going to try and do a little step out to the side and back to the middle. Step out to the side and back to the middle. So it's a little bit like our single leg squat, but a bit more lateral this time. Out to the side, back. Great work, guys. This is a really tough one, so you're doing really, really well. Keep up the good work. So what you'll notice with the exercises that I've chosen, because our joints very rarely move independently of each other, so it's unusual that your knee moves without anything else moving. It's unusual that your hip moves without anything else moving. I've given you exercises that are using multiple joints at the same time. So a squat is going to be using ankle, knee, hip, back. This exercise, ankle, knee, hip, back, core. Your deadlifts, back, hips, knees. So it's a more functional way of exercising, and it's a more time efficient way of exercising, because you can do more, or you can get more out of doing one exercise. And we know that everybody is very busy. So we need to make sure that things are as time efficient as possible. Beautiful. Right, what have we got next? Split squats. So what am I going to do for this one? Let's go right leg in front first. So I'm going to go this way. Right leg in front first. I'm going to hold my weight in the opposite hand. Again, going back to stability, holding on is not cheating. Make sure you are stable. So you're going to separate your feet, nice wide base. You're going to go down, up, Once again, working through a range that you feel comfortable with. If you only want to go here and you want to do 25% of the movement or 50% of the movement, then you do whatever you feel comfortable, and you can change between left and right. So if one knee is a little bit sorer than the other knee, then you might go a little bit lower on one side, and it might be that you need to go a little bit higher on the other side. That is absolutely fine. You guessed it, swapping over and doing the other side. So left leg in front, this time right leg out behind, and then you're going to hold on to your weight. Obviously, weights are a very nice objective measure for your improvement. So if this is an exercise video that you like and you decide to do again and you practice it, you might want to do it 2 or 3 times a week to stress those muscles, stress those thighs, hips, back, to try and improve your knee and hip pain. You can gradually increase the weight as you practice and as you feel comfortable. But I certainly would hope that you don't get to to the end of any of the videos and feel like they're quite easy. They should be a challenge. Oh, one more. Okay. Whew, that was tough. Great work. Right, back to sit to stands. So, grab your chair back. If you don't want to use the chair, then you can just do another squat. That's fine. I'm going to do the sit to stands. Appreciate a little rest, to be honest. Get your breath back. We're doing one more round all the way through. So nice and close to your chest. Stand up, sit down. If you're looking at this sort of weight and you're thinking that's too much for me, for my knee pain, then don't worry. Just find something that you feel comfortable with. If you want to try the workout without any weight at all, then that's fine as well. It is a tough one. Good. Brilliant. And like I said at the beginning, the idea of this program is to give you exercises that are functional for your day-to-day activities. So why are we doing sit stands? Straightforward, isn't it? Yeah, we want to improve. One thing that's common if you've got knee pain in particular, struggling to get out of a chair. If we want to get better at it, we need to practice it. Why do we need to practice bending and lifting? So our half deadlift, well, if we want to be able to bend and lift, then we need to practice it. Your split squats are going to be helpful for getting on and off the floor. Your single leg heel raises are going to be functional for you coming down the stairs. So whenever you're doing an exercise program, specifically for a joint pain, it needs to be functional for you. It needs to be targeted to the things that you are currently finding difficult during the day. So next one is your single leg squats. It's not just a case of saying, here's some exercise, get on with it, let's hope it helps. It's about giving you specific exercises that are tailored to your needs, tailored to your goals, that you want some support and help with. Whew. Okay, right, I'm gonna go right leg first. Up to you whether you do left or right. We're gonna hold on, single leg squat, and back up. Single leg squat, and back up. And why are we doing standing exercise? Why are we doing it in weight bearing? Because our joints need to be able to tolerate our body weight at least through range with load. If we're thinking about picking up shopping, if we're thinking about running up the stairs, if we're thinking about picking up grandchildren that seem to get progressively heavier as they get older, then the exercise that we're doing needs to replicate the things that we want to do day to day. So if we've got a 10 kilo grandchild, we need to be lifting 10 kilos. Okay, all right, 10 seconds. Holding on, make sure you're nice and stable, make sure you feel safe. And then we're gonna do the other leg. So just dipping down, stick your bum out, bend your knee, and down we go. Stick your bum out, bend your knee, and down we go. Oh, flying through this program, flying through this video. Great work. Thighs should be aching. Bum cheek might be aching. Oh, great work, guys. Doing really, really well. I hope you're feeling hot and sweaty. I certainly am. Okay, good work. 30 seconds of rest. This time we are moving on to the supported heel raises. So holding on, heels up, heels down, heels up, heels down. Okay, if you want to pause the video just for a second, grab yourself a glass of water. This is a toughie. Don't feel like you're cheating. Key thing is getting through to the end. So 5 seconds left. Off we go. Up and down. Like I said, you want to be trying to work through as much range as you can. Try not to do a little one like this. You want to get right up onto your first and second toe if possible, and then slowly down. Right up onto your first and second toe if possible, and then slowly down. Like I said, nearly all of these exercises, if you haven't got any dumbbells, then you can just do with a rucksack on your back, and you can improvise with whatever you've got at home. Whew, okay, 30 seconds of rest. We are moving on to the squats. So, once again, bottom out, knees behind your toes, nice straight back, keep looking forward. Like that. But I'm gonna make the most of the last 10 seconds rest. And off we go. Let's get ready. Bam. Okay, working through a range that you feel comfortable with. If you want to do a small one, that's fine. If you've got a bit of stiffness in a knee or both knees, just work through a range of movement that you feel comfortable with. Out to the side is next, I think. Yeah, our lateral step up, so our lateral steps. Oh, okay, great work. So I'm popping that down. No, I'm not. Actually, I am. Hard work. Next one, weight in your hand. I'm going to do the right leg. We're just going to step out to the side, back, step out to the side, and back. So 10 seconds. Get yourselves ready. Don't go until you have to. And going in 3, 2, 1. Out to the side and back. One thing I haven't mentioned is pain. So we are looking to stress the system. We are looking to challenge ourselves. And as a result, we have to balance how much pain is the right amount of pain to be working into. And that is certainly something that can be tricky to manage if you are exercising and you're trying to do things by yourself. There is a rule of thumb that we use in terms of how much pain is the right amount of pain to be working into. A little bit of discomfort is still fine. It's safe. You're stressing the joint, and if you're doing something that's new, it might be a bit uncomfortable. We're looking for that kind of gym exercise soreness. So if you have symptoms, let's say we're talking about knee arthritis, and you do this and your knee's a bit sorer after, but it's manageable, and it's sorer on top of your current baseline for a day or two, but it's manageable, and it's settled back down to baseline within those 2 days, then that is the kind of rule of thumb, if you like. That's what we're looking for. That is safe. Now, it's not that it's not safe if you get more than that, it's just that we've just done a bit too much too soon. So we've probably overloaded the joint a bit too much, a bit too soon. The recommendation would be don't stop. Whew. Okay, last one, split squats with support. The recommendation would be, I said don't stop. You might want to let things calm down. Rather than don't stop, don't avoid what it was that you were doing before completely, but go back to it. Change some sort of variable, reps, sets, load, range of movement, rest days to make it easier. So 1 foot in front, 1 foot behind, hands down here, and you're doing your split squat. So if you are working on a movement pattern that's a challenge and you try it and it's too sore, then don't worry. There's so many things that we can do to make it easier. We can hold on for one thing, we can add support, we can decrease load, like I said, reps and sets. So what we want to avoid, definitely want to avoid, is finding something uncomfortable and then consistently avoiding it going forwards, because, well done guys, that is a slow spiral, negative spiral of gradually doing less and less and less. And we don't want to do that. We want to find a level that you can manage, because with a squat, for example, you can do a 20 kilo squat without holding on, or you can hold on with both hands and do 20% of the movement. So there's a massive spectrum of regression or progression that we can give you. It's just about finding where you are, great work, and then progressing from there. And it's very unusual that we can't regress in exercise back to a level that you can manage. And it's just about a little bit of trial and error at the beginning to work out what you can manage, finding that kind of baseline, finding that platform, and then progressing when you're happy. Okay, I've rambled on so much. We're nearly finished. 5 seconds. Oh, great work. Okay, well done guys. I hope you found that helpful. I really hope your legs are burning now, because mine certainly are. If you have found it helpful, don't forget to like the video and subscribe if you haven't already, so you don't miss any more of the osteoarthritis workouts or education videos to help you help yourself at home. And whilst you're doing that, I will see you in the next one.